My name is Eric Weinhandl. I'm the Director of Home Dialysis Research at the Hennepin Healthcare Research Institute in Minneapolis, Minnesota.
My name is Kalantar, or Kalantar-Zadeh. I'm a nephrologist, professor of medicine, and chief of nephrology at the University of California, Irvine in Southern California.
So let's start off with a little bit about your background. I'm curious about if you could give me a little bit of your understanding of your program's experience with home dialysis in general and home hemodialysis specifically.
When I joined the University of California, Irvine in 2012, the Division of Nephrology at that time had a relatively small dialysis center with 90 to 100 inpatients and around 10 to 15 home patients. All of them except for one were peritoneal dialysis treatment receiving patients. So, and we had one patient on home dialysis who was running this for a number of years but using the old modality. So this is where we are. This is how we started 8.5 years ago. And then since then, we continue to grow and expand. Today, I'm just going all the way to where we are right now, almost 90 years after where we started. We have over 300 patients who receive dialysis. Interestingly, 65, close to 70 of them are home patients. And out of whom, almost 20 of them, 20 patients, are under home hemodialysis. And interestingly, the bulk of them, they actually chose home dialysis over the past 12 to 18 months.
Interesting. And so what has been the impetus for that growth in the most recent time? Is it COVID or is it something else?
That's a good question. I'm not sure if COVID played an important role. It was definitely a factor. It was a contributor. However, it was probably a combination of different factors. It's difficult to find one or two drivers. One is that with the executive order of the US president, apparently in July 2019, there was more emphasis on home dialysis. And I think that really played an important role. Even though many components of that have not started being implemented, the fact that people keep hearing about this, American Kidney Health Initiatives and ETC and other models, so people get ready for that. And the mentality is already changing. And when I say mentality, it's both providers and the patients, right? Patients hear about this, providers, nephrologists, non-nephrology, allied health care professionals, and others. And the second one is that to the credit of dialysis companies, they have been realigned with these goals. I always thought that there should not be a barrier between patients who are in-center and patients who are interested in training or undergoing training for home hemo. Now, to the credit of one of the dialysis providers, the unit known as Next Stage, which is essentially the unit we are using on almost all of our patients, now this is being placed in the center of dialysis clinic. And when we started this program, this led to a major increase in interest and enthusiasm because patients are now seeing what's happening, right? Seeing the machine, looking at the machine, how the size of the machine compared to the big high flux dialyzer. So that played a role, as well as other things we can discuss.
How do you go about the discussion around modality with your patients?
Your question would be even more relevant as to how we ask this question or offer answers to patients who have been on dialysis, in-center dialysis for a number of years. Can you imagine, I go in front of a patient I've been on thrice-weekly dialysis in-center for 5 years, and after half a decade, I say that, hey, what do you think about home dialysis, right? And initially you think that patient is going to really be surprised and says, hey, what's going on? What happened today? Where were you guys for 5 years, right? And this indeed happened. This is what we felt empowered. When I say we 17 nephrologists at the University of California, Irvine, including our 6 fellows. So we had these internal discussions among others, and not systematically doing so, but gradually saying that, hey, let's talk more with patients about dialysis at home. And then some colleagues said, so, well, is it only for new patients? No, actually for everybody. So is it for patients that have been on dialysis for half a year? No, for everybody, every single person. And we were surprised when we asked them, says, would you like to rethink your options? Can I share with you some more from home dialysis? Can I ask Mr. Smith, who has just converted just 6 months ago after 3 years, and can he come and tell you more? So these are the way that I have started. And I've told my colleagues, that means all 10 to 17 nephrologists who are rounding in dialysis centers, please, each time, every month, it's not too much to ask them, do you want to think about home dialysis? Would you like to give it a shot? You want to try, right? So yeah. I think it requires that we really change the culture, and we did. And we're still in our infancy. Let me tell you, the fact that last year we had 5, and this year we have 17 plus, and 3 years ago we had 1, that suggests that we can still do a lot.
You've got a growing number of patients in your program that are on home hemodialysis. Tell me a little bit about an example of a patient, if I may characterize an example, as someone who, maybe the patient came to you, said, I want to try home hemodialysis. In your clinical experience, you wondered a little bit whether this was going to be successful. Maybe it's going to be a really significant challenge, but it's turned out great. Do you have anything like that in your practice right now?
It's interesting that you asked, because all of these 15 to 17 patients, they have stories who have shared with me that are unique and inspirational and educational. It's amazing what you're saying. Each of them, every of them, sing one by one how they managed to, especially the newer one. As I said, last year we had only 4 to 5, and now we have 15 and 2 under training, 17. And it's going to actually, our target is 20 by the end of next month, because right now we're running out of training rooms. So all of them, those who are even under training. So one of them was the one that I felt bad, because this gentleman, young, middle-aged, after transplant failed and started in-center dialysis, and after half a year, I managed to have this discussion with him that, look, let's give it a shot, let's try. And he's doing home hemo using Next Stage 5 times a week. And he has had some hospitalizations. He has some comorbidities. He had stroke because of the underlying disease, and then was hospitalized a number of times. And each time I asked him, I said, hey, I think it's time for you to give a vacation to home hemo and come to center for a while. And he says no. And I said, look, if you come to in-center, we can lower the frequency to 3 times a week for you. Then he says, Dr. Kalantar, this is not about frequency. I am happier at home, and I'm doing everything at home. And he asked me, he says, so Dr. do you think all these infections is because of home hemo? I said, no, this is something else. You know that your infection and other problem has nothing to do with dialysis. Then he says, then why are you asking me to switch? All right? So now the patient is asking me, the patient is more adamant, right? And this was highly educational for me. I said, wow, why can't I learn from this patient? Why do I blame problems of a home hemo patients on the entity home hemo? And why can't I learn from the patient? That patient is telling me that this problem, that problem, my stroke, my infection had nothing to do with these things. Home hemo or in-center would not have played any role. If anything, I'm happier with home hemo. So after each discharge, he continued with home hemodialysis, and he's doing well now. 2 months, haven't had any hospitalization. So I felt that this is a story that we all need to appreciate and learn. So that means learning from patients and patient experience.
AdvancingDialysis.org is dedicated to providing clinicians and patients with better access to and more awareness of the reported clinical benefits and improved quality of life made possible with home dialysis, including more frequent, more intensive, and nocturnal therapy schedules. All forms of hemodialysis, including treatments performed in-center and at home, involve some risks. In addition, there are certain risks unique to treatment in the home environment. Patients differ, and not everyone will experience the reported benefits of more frequent hemodialysis. Certain risks associated with hemodialysis treatment are increased when performing nocturnal therapy due to the length of treatment time and because therapy is performed while the patient and care partner are sleeping. AdvancingDialysis.org is a project of Next Stage Medical Incorporated.